Hello, everyone. It's me again, Dr. Azad Hamid here, and I have with me Dr. Aida Qaraitam. And today we have the pleasure of meeting two students, Aliyah Rabah and Duha Musa, who have a fantastic presentation lined up for us to tell you a little bit about Ramadan practices and how that affects, our occupations, daily occupations. So before we dig in the good stuff, I would like to welcome them both and give them the chance to tell us a little bit about who they are as an OT, as an Arab. And then we can talk about the feature presentation. Let's start with Aliyah. Hi, Aliyah. Welcome to our session here.
Hello, thank you for having the both of us. We really appreciate it. And so being an Arab Palestinian American occupational therapy student has been quite the journey, and I'm only on my second year. But alhamdulillah, it's been a good journey because I have Dr. Karadam who I can speak to whenever, problems arise. But I feel that being an Arab Palestinian American occupational therapy student has really aspired in this program because I get to show my actual self. I don't have to hide my Arab identity, and I feel like a lot of people are appreciative of that because being an occupational therapist, we learn to be culturally competent, and we need that living in America. So yeah.
We do.
Definitely.
Thanks for that introduction, Alia. And I'm glad you're, you're seeing this as like, a comfortable space for you to show your identity. I think this is very important. A lot of students from marginalized community don't feel the same. So this is really important. Hopefully we'll have you like on another episode where we can talk about all of that. Duha, welcome to this session. And why don't you tell us a little bit about yourself?
Hi, my name is Duha Musa. I'm an occupational therapy student at Aliyah Brooklyn. I'm Egyptian American, and I'm very excited to learn more about occupational therapy because culture is so engrossed in every occupation that we do. For example, whether it's finding mindfulness while using a rosary, or maybe you're going on walks to go to your church, stuff like that. So being culturally competent is really, really important in occupational therapy, and it's been very, very fulfilling to see that and like refreshing to see that throughout our community and wanting that to grow more and more.
Yes, well said. And this is why we're doing this. So we can share.
Excellently said. Thank you so much for that. Wonderful.
Yeah, share that culture. So, and before we start like with the presentation, Aida, if you can tell us a little bit of how you came across Aliyah and Duha, and how did that experience feel for the first time? Like, it was like, oh, you recognize the identity. How did that go?
It was a beautiful experience. It was, Duha and Aliyah were the first cohort I taught as an academic. So it was my first day on the job as a professor. Before that, I was a clinician. So I was teaching the introductory pediatrics course. And, I looked at the names, and as an Arab, we tend to spot each other. But obviously I wasn't going to make any assumptions. But it wasn't until, I'm laughing about it. It wasn't until a yalla slipped, it was a yani, one of those words, as I was presenting the lecture.
Right.
And also during one of the case studies I was presenting, I said mama as opposed to mom or mother. And then Aliyah approached me and asked me, Dr. Karadam, where are you from? And I said, I'm Lebanese Palestinian. And then that's when we all shared that. And how did I feel? I felt relieved. I felt, okay, there's more of us here. And it's not that in my other experiences during my career, I felt that I had to hide or anything, but it really opened up ideas that I had. And as a professor, I saw the promise, like I saw the promising work that the Aliyah and Duha were doing. Mm-hmm. So I felt relieved and excited because then they were in my mind. All right, I can work with them. Let's start doing some work.
Yeah. And for those who are listening to this and have no idea what yalla or yani means, do you want to tell them what that means and why is it this, easy to slip?
So let's start with yani because it actually confuses individuals. Yani means. It means mean?
It
I
means
don't know how to
nothing.
say it. It means nothing. It's a filler word similar
It's a
to
filler.
like, but, and same thing with yalla. Yalla can mean let's go, but it can also just be a filler word. It's
Whatever, or like
whatever, yalla, and
go with it, or
yeah. And this is something our allies should know, that we talk with our hands a lot. And even on the Zoom meetings, you see me trying to control it. But the term yalla, there is also a hand gesture depending on yalla. Just chill. It's okay.
yeah,
Yalla.
it could be outwards like this, like yalla yalla, or like like yalla yalla.
Yalla.
So,
Yalla. Let's
yeah.
go. So new Arabic 101.
Right. Yeah. So I wanna, go back to that question, Aliyah and Duha. How did it feel to find or identify like a faculty member with the same identity or like similar identity? I don't know. I shouldn't say the same, because we do come with different layers of the Arab identity. But like, how did it feel, Aliyah, when you walked up to Dr. Kraitam and said, like, where you're from? How did that feel?
I honestly felt a sense of belonging in this community. And I just thought, subhanAllah, because it was her first year, it was my first year, it was Duha's first year. So we just felt like it was like a sense of relief, because I'm like, wow, like if I seeing, like you said, like a similar identity in an academic, like as an academic professor, I thought, wow, this can be me one day. Like the possibilities are endless. So yeah, I felt a sense of belonging, and it was honestly remarkable. Like, alhamdulillah.
Right. You speak to the power of representation, and that's exactly why we mean by like we have to diversify the communities of OT, because representation matters. When you see someone you identify with and you can relate to, you can see yourself, being in that role again, or like at some time. So it is very powerful. Duha, how did it feel for you?
For me, I was really surprised to see that there was another Arab in the program, like especially a professor. Like I've never seen that throughout my entire years of being in LIU. Um, so I was just very, very surprised. I wasn't even sure that she was Arab at first. I was too
Yeah.
scared to ask, trying to figure it out.
Yeah.
But it was really, really exciting.
That's good.
Like Aliyah was saying, like we could finally like picture ourselves in something in a position like that. And I started thinking to myself, wait, could I be like a TA or something? Maybe, who knows? Like stuff like that. So it definitely helps to see yourself in a position.
Yeah, absolutely. Again, it's the power of representation. So
100%.
well, I'm glad this happened, and I'm glad we coexisted in, networks that we can meet and talk about this more.
Absolutely. Before we do move on to the presentation, Duha, you touched on something that Dr. Razan Hamid, I always see your full name. Dr. Hamid.
That's my fault. I'll change my name.
Dr. Hamid and I discussed last time is that, we pass. You weren't sure if I was Arab. The name Aida, the last name Kuraitim, it's not as Arabic standing out wise. And that's something that we can discuss forever, how we can pass. And that's a blessing and a curse at the same time. So I'm just happy that you discovered I was Arab, and I discovered you amazing students. So thank you for that.
That's great. That's great. All right. So ladies, we're going to give you the floor now. Feel free to share your slides and let everyone know, about Ramadan and fasting.
Okay, I'm just gonna share my screen real quick.
All right, take it away.
Okay, so now we will begin with our Ramadan presentation. So AOTA's statement on diversity. American Occupational Therapy's AOTA's Vision 2025 conveys a strong commitment to diversity, equity, and inclusion. AOTA affirms the right of every individual to feel welcome, valued, a sense of belonging, and respected while accessing and participating in society, regardless of internal or external factors that make every individual unique. This statement supports efforts to increase diversity, equity, and inclusion within all aspects of occupational therapy, including practice, research, education, as well as policy development and advocacy. So what is Ramadan? Ramadan is a holy month for Muslims. It follows a lunar calendar, hence it is a different day and month every year. And fasting in Ramadan is one of the 5 pillars of Islam, meaning 5 pillars of Islam is these are mandatory acts of worship a Muslim must comply with. In addition to the 5 daily prayers, Muslims pray Taraweeh, which is an extended night prayer. This is followed by Eid al-Fitr, and Eid al-Fitr is a time for family to come together, children receive gifts and toys, and adults most likely receive money. So what is fasting? When Muslims abstain from food and water from dawn to sunset, iftar refers to the meal one has when breaking their fast at sunset, and suhoor refers to the meal one has before one starts their fast. And suhoor this year is around 4 a.m. if you're in New York. Now, why do Muslims all around the world celebrate this holiday? It's to practice taqwa, which is God consciousness, to teach patience, develop spiritual strength, to feel for those in need who experience hunger and struggle. And it's also a way for Muslims to realize that if they can withhold from their temptations and desires, these temporary changes can become permanent changes, which is a great way for boosting your self-confidence and your mental health.
So who's exempt from fasting? The people who don't need to fast are including young children, the elderly, people with physical or mental incapabilities, causing them to be unable to fast. For example, if they have a heart transplant or if they're diabetic, pregnant women and breastfeeding mothers, travelers, and menstruating females. People who are unable to fast can donate to charity as an alternative. So these are some suggested nonprofit organizations that some are local. So we have the Asaya Women's Center. It provides temporary housing for victims of domestic violence and women facing eviction and homelessness. It's local in New York and New Jersey. And there's the Muslims Giving Back organization. It provides clean water, solves hunger problems, refugee support, and it's an international organization. So how can all of this be implemented into occupational therapy? One example is that if an OT has an adolescent client who wants to begin fasting, the OT can help the client alter their routine with a planner to prepare for the altered sleep and eating schedule during Ramadan. If the OT is working with an older client, they should keep in mind that the client is abstaining from food and water from dawn to sunset, and the OT should grade down some activities to make sure that the client doesn't get dehydrated or fatigued. And one more example is if a client has osteoarthritis in their digits and they enjoy baking sweets for Ramadan, maybe the occupational therapist can introduce interventions that revolve around manipulating thin sheets of phyllo dough to make balewa. The OT can introduce adaptive equipment such as a built-up roller or built-up utensils in order to ease the grade down the activity for the client in order to match their needs or whatever level of function that they need in that time. Can we go next slide? Okay, thank you. Okay, so in conclusion, as occupational therapists, it is imperative that we embrace the differences amongst ourselves and our clients and the communities we work with. Although understanding every culture and religious practice can be challenging, we can begin with enhancing our cultural awareness with small steps in the form of educational opportunities. It's okay not to know. Ask questions from a place of respectful curiosity. Thank you guys. And thank you for Dr. Hamid and Dr. Kureitem for allowing us this opportunity to share our presentation.
Thank you.
Yeah, thank you for sharing this. And I think it's important, for the OT community to understand what this is. And let me just emphasize a couple of things, which, it's a common question. It's like, fasting, and you described it well, Aliyah, but it's very important that people understand. It's like when we say fasting, it's fasting from food, from drinks, from chewing gums, smoking, anything that you can ingest or digest. And I think a lot of people, and this may come across as culturally insensitive when people ask. So like I'm saying this just to be aware and mindful. When people say like, oh, you can't even have a sip of water. How can you even stand that? this could be disrespectful to the person who is fasting. So maybe, and sometimes it comes from a place of curiosity, or like, you know, people are not aware of this, but this is like, you know, this speaks to the culture of humility. It's appropriate to ask questions like, you know, do you mind if I asked what kind of food or drinks can't you have during fasting? Is different tone than not even water, not even, you know, chewing gum. Like, yeah. So this is, I think, one of the things that we have to emphasize. Asking questions is perfect. The tone of how you ask questions may come across to those who observe Ramadan as culturally insensitive. So keep that in mind as future culturally mindful practitioners if you're listening to this.
Absolutely. Thank you for saying that, Dr. Hamid. Like you said, there's a way to frame it. And we're all guilty of it when we're shocked. You know, if I'm not aware of a certain Jewish holiday, which I've learned so much about in the last 2 years being at LIU, I caught myself because in the beginning it was, what? 24 hours of fasting for this? I stepped back and I use that voice. If you don't mind me asking, well, what do you say on this holiday? What is it that you do? So questions are good, just how you frame it.
Yeah.
If you don't mind, can I just, because my smile exploded when Aliyah mentioned the Eidiyah, the gifts and the last days of Eid. So maybe just a fun little thing, Aliyah and Duha, if you can share maybe what was one of your favorite Eid gifts, the gift that we get at the end of Ramadan, just very quickly. I don't want to take too much time.
Mine was a box of henna because I found that it's been a leisure activity for me for last Eid. So last Eid, my mom actually got me a box of henna, and I've been trying. It's been trial and error, but it's okay. I have sabr. That's all you need. You need patience with it. So that was my favorite.
That's beautiful. And Duha, if you'd like to share.
So we don't really have any family here, so it's just us. So I get idea from my dad. So when we were younger, it was always $1 for each kid, and then now we've evolved. It's become $20 for each kid. So
Mashallah,
we're hitting new highs.
yeah, you got a promotion.
Yeah.
Yeah.
And that's a good question, Aida. And I think, you know, it's important for people to understand that the Eid al-Fitr is like a celebration of the end of Ramadan, that you've done it, you've completed this. So it is declaring, you know, one of the two holidays in the major Islamic calendar. Eid al-Fitr is one of them. The second one is another Eid al-Adha, which comes and a few months after. So people who observe Ramadan like look forward to this. And I think, again, like, you know, going back to that culture humility piece, it's very appropriate and it's actually encouraged to ask about Eid. When is Eid coming? Because this is one of the things that people look forward to, and that will be a great conversation, and people like to open up about that. Yeah. So, you know, if you're not sure about asking questions about Ramadan, you can ask about Eid because they're linked together, and it's a great conversation to have if you want to learn more about this.
Absolutely.
Okay. Any other thoughts? There's so much that we can talk about Ramadan. This is just, you know, the beginning, and maybe we can, you know, talk more to our community about, you know, about this to this group about, you know, a day in someone who's fasting, or like, you know, how that affects someone's life. Maybe we can feature an iftar one day, like, you know, a family having iftar. That is also fun, and I would love to hear your thoughts about this sometime this month.
Absolutely. I think that's an amazing idea. Also, because you'll see, you know, we talk about this all the time, that there's diversity within the Arab culture, Middle East, North Africa, but there's diversity even within families. So how my family would have iftar is going to be very different than how Aliyah or Duha would have iftar. Right. So sharing that, you know, celebrating the differences. So families eat so much in iftar, during iftar, and others, like my family, it was tamar, sambusik, ulaban, and then we ate later. Yeah. So just sharing those differences would be a really nice idea. Yeah, celebrating diversity within diversity. So yeah, so many ideas. Talk about that. Yeah. طبعا المسلسلات, the series. So Ramadan is a big for our allies. Ramadan is also a time of the year where there's a lot of good shows to watch. So we tend to talk about the episodes.
Right, right. Yeah.
I think Bab Hara brings everybody together though. That has to be the top one. Bab Hara. I love that show.
Hara. And for those who don't know, that's been going on for 13 seasons now. It's based in Syrian history. I think this season is talking about the French colonization in Syria, which could be educational if you're interested. So it's really nice.
So as you can see, for those who are listening, this is not just a holiday. It's a worship month. It's a celebration. It's time for family to come together and celebrate so many things. It's also a big time for entertainment. So it is like a balanced month in a sense, and a lot of people don't get that. So it's not just all worship. Worship, there's family time, there's nutrition time. So it is a beautiful thing for those who observe it. So hopefully, if you have any questions, to those who are listening, reach out to Aliyah, Duha, Aida, or myself. And hopefully you will, share this presentation with others, maybe students, if you know, in the area.
Yeah.
All right. Thank you so much, both of you and Aida, for bringing them to this. And I look forward for future conversations about other things related to our community. So thank you and happy iftar now.
Ramadan Kareem, happy iftar, and thank you so much, Aliyah and Duha.
Yeah, and this is we should have started with this. It's like, what kind of greetings do you say to someone who's observing Ramadan? You can say Ramadan Kareem or Happy Ramadan is all acceptable. Or you can ask the person, like, how do you say that in your culture? And they'll let you know. All right. I'm not going to keep you longer, so go enjoy iftar. I will talk to you later. Thank you so
everyone.
much.
Have a good night. Take care.
Thank you so much.
Presentation.
Bye. Yeah.